What is the hidden history of medical experiments on patients? Have you ever wondered about the darker side of medical research? The hidden history of medical experiments on patients reveals a troubling narrative that intertwines ethics, politics, and human rights. This story is not just about science. It is about the people who were affected and the ethical principles that were often ignored. Throughout history, many medical experiments have been conducted without the consent of the individuals involved. This lack of informed consent is a fundamental violation of healthcare ethics. Vulnerable populations, including racial minorities, prisoners, children, and the economically disadvantaged, have often been the subjects of these experiments. They were subjected to harmful procedures without their knowledge or permission, raising serious ethical concerns. One of the most notorious examples is the Tuskegee syphilis study, which took place in the United States from 1930 to 1972. In this government-sponsored study, African American men with syphilis were deliberately left untreated to observe the disease's progression. Even when effective treatments became available, the researchers chose to withhold them. This study highlights how political and racial dynamics can lead to unethical research practices, exploiting individuals who were misled into believing they were receiving medical care. During World War II, the situation became even more dire. Nazi Germany conducted horrific medical experiments on prisoners in concentration camps. These experiments included exposure to infectious diseases and sterilization, all masked as scientific research. Similarly, the Japanese Unit 731 performed brutal experiments on prisoners and civilians, including vivisections and chemical warfare testing. These actions were driven by political ideologies that disregarded human rights. After World War II, the world began to confront these abuses. The Nuremberg Code was established to set standards for voluntary consent and humane treatment in research. However, unethical practices did not cease. Various experiments continued, often targeting marginalized groups, such as exposing military personnel to radiation and toxic chemicals without proper consent. The intersection of ethics and politics is crucial in understanding this hidden history. Political power often dictated who was chosen as subjects and how research was conducted. Ethical considerations were frequently subordinated to political or military goals. Public outcry and investigations, such as congressional hearings in the United States, have led to stricter regulations and oversight mechanisms to protect human subjects in research. From a healthcare ethics perspective, this history emphasizes the importance of informed consent, respect for individual autonomy, and justice in research practices. It also illustrates how political contexts can undermine or support ethical standards. Ongoing efforts aim to ensure transparency and accountability in medical research, as well as to provide reparations and recognition for victims of past abuses. Understanding the hidden history of medical experiments on patients is essential. It reveals a pattern of ethical violations intertwined with political agendas and social inequalities. This knowledge helps shape policies that protect human rights and uphold ethical principles in public health and medical research.